primary care office, so we take care of all kinds of things. We take care of acute care patients, but we also provide a lot of chronic care, and our patients have high incidence of diabetes, hypertension, heart disease, high cholesterol, and those sort of things. And it's those kind of things I think that we're especially adept at serving people.
No hay veces cuando él va a empezar a dormir a la mesa cuando está comiendo algo. No.
I think diversity is really the sums it up, because we see just everything. You know, that's what makes it interesting. From little babies and even doing prenatal care, seeing the babies before they're born, to I saw an 87-year-old today. Many times the patients are related, and so there brings this dynamic of understanding that family behind what the patient brings to the office.
I feel like we have a holistic approach to our patients that come into the clinic, and personally I volunteer with a reading program, so we're encouraging people to be literate and to use books. But I guess also that idea of treating everyone who comes in the door as a person of worth, and you know, that they can be listened to, their story can be told.
What we do is a community health center, preventative health, relational health, enables people to function, and they may not be able to get that same kind of care if we were not here.
There are a lot of different reasons people come here. You know, some are of course coming out of jail and they have no place to go, or they've had addictions and families have just sort of said, we're done, we can't help anymore. Sometimes they come to emergency shelters, sometimes they come here to do our life skills program, or now it's called discipleship program, which is now a year long.
I was living with my fiance, he died, and he left the house to his kids, so I had no choice but to come here.
Every client is different. So some might need help with getting their insurance, some might need help getting an appointment, whether it be with a dentist or a doctor, an optometrist, depending on the need, and she is really good at helping our clients make those connections.
I'm glad to have this place. Glad that Holland Hospital is helping me or, you know, putting me here. So we love every person who walks through the door, no matter if it's the first time or the third time or the seventh time. You know, it's that's why we're here.
We see anything from high blood pressure to kids that are insulin dependent, kids that aren't insulin dependent but have sugar issues. So we see a lot of different things that are more long-term and not just an immediate fix.
We have over 200 students that have emergency medical plans that we've had to put in place, maybe for a seizure problem or diabetes, something life-threatening that we really felt they needed a plan of action in case something happened at school related to that disease process.
It makes me feel so much more comfortable that the nurse is right there, and I know that she will be taking care of him or her, and that doesn't fall on me to try to assess what all is going on in that situation.
It's more than just putting a Band-Aid on a scrape. Really, anybody can do that. It's trying to get in depth and see what's going on and how can we help.
Of all the things I've done in nursing over the last 35 years, this is the best. So I know I couldn't imagine myself being anywhere else. I love this job.
Well, screening mammograms are the best tool that we have right now to detect cancers early when they are easier to treat. So if women wait later until they have symptoms or a lump that they can feel, often that means that the cancer is being detected later and has progressed further and may be more difficult to treat.
We cover anything from just your basic yearly screening mammogram to diagnostic mammograms if someone comes in with an actual lump that's palpable and that requires further workup with diagnostic mammogram, ultrasound, And then based on what those tests might find, the biopsies are also covered by the fund too.
I've just recently had a patient that was filling out forms prior to her exam, and her daughter was with her, and she's like, you know, this is so good because otherwise my mom wouldn't be able to do this.
For women that I have talked to that have found out that these funds are available, there is such a sense of relief that, whew, okay, I can get that. It's not going to impact me financially, and I can do something for myself. That's very important. And you know, if we don't take care of ourselves, then we can't be there to be the mom and the sister and the wife and the daughter and all those roles that we play.